I am Dr. James. To date, I have accompanied thousands of elderly individuals on their health journeys. But what if I told you that today I'm going to tell you about that secret truth that will change your life, something that probably no doctor has ever honestly told you before? After the age of 70, some health checks for the elderly can do more harm than good, even putting your life at risk. Yes, you heard right. Every year, millions of older adults undergo unnecessary tests in order to live longer, stay safe, and detect diseases early. But very few senior adults know this. Some tests can actually lead to more stress, surgery, permanent damage, paralysis, or even cancer. And even more striking, most of these are tests that are recommended to you as routine. Now you will learn about the 5 dangerous health checkups you should avoid after the age of 70 and why some tests do you more harm than help, with frightening details. You won't believe which test comes in second place. And yes, some of them may surprise you or even anger you. Because when decisions are made about your health, they may not show you the whole secrets. But don't worry, I'll tell you all the secrets in their naked truth. Watch until the end. According to recent scientific analyses, 37% of medical tests performed on elderly individuals result in unnecessary treatments. These unnecessary tests can often lead to unnoticed complications, unnecessary medication use, and even lifelong health problems. But what's even more striking is that 99% of seniors over the age of 70 don't even realize that they are undergoing excessive screening. Without realizing it, they are putting a strain on their bodies every day. What's more, one of these tests is responsible for 5% of all cancer cases in the United States. This rate is almost identical to the cancer risk seen in people who consume alcohol regularly every day. You probably haven't heard this from your doctor. You won't see it in TV commercials either. But real scientific data is quietly warning us. Are you curious about what lies beyond the cliche of early diagnosis is good? So subscribe and watch the video to the end, because this channel takes a scientific look at elderly health. Share your age, location, and a health test you have had done that you regret in the comments. We read every comment and respond with personalized recommendations. Share this video with your loved ones so that other seniors can benefit from it too. We begin with the 5th test, DEXA bone density scan. Did you know that one of the most common and seemingly innocent tests for older adults is a bone density scan? No pain, no needles, just a few minutes of scanning. As you leave, you are handed a piece of paper. How strong are your bones? But the truth is not that simple. Medically known as a DEXA scan, it is commonly used to detect osteoporosis. But no one tells you this. Did you know that after the age of 70, this test shows bone loss in almost everyone? Because bone loss is natural at this age. Just like gray hair or wrinkles. It happens to everyone. But the problem is that when you get the results of this test, the fear begins. Doctors immediately prescribe bone-strengthening drugs, such as bisphosphonates. And that's where the danger begins. So what can these drugs do to you? I know they haven't told you much about these drugs. However, many elderly people who use them experience the following terrible problems: severe stomach problems, death of the jawbone, inflammation of the esophagus, strange fractures in sensitive bones. One of my patients who used this medicine was Sophia. She was a 78-year-old, retired violin teacher who enjoyed life and went for a walk every morning. He had never fallen before. He had no pain either. But the doctor recommended a DEXA scan. The DEXA scan showed osteopenia, meaning a slight decrease in bone density. The doctor immediately started him on the bisphosphonate drug Lendronate. 3 months after starting the medication, he seemed to have lost all his energy. He had severe reflux, jaw pain, and unfortunately, when we saw him, he could no longer play the violin he loved so much. Sophia was desperate and chose to trust us. We recommended healthy methods as usual. When we stopped the medication and started a calcium-rich diet that included vitamin D, resistance bands, weight-bearing exercises, and green leafy vegetables, that's when he came back to life. A year later, he was back on stage with strong legs, 0 fractures, and brand new energy. The truth is, according to research conducted by the American Geriatric Society, these drugs were monitored in more than 1,200 women over the age of 70, and it was found that bisphosphonates reduced the risk of fractures by only 0.3% after 5 years. In other words, treating mild bone loss with medication in people over the age of 70 has almost no effect on fracture rates. That's a terrible rate. So what are the side effects of bisphosphonate drugs? They are much more common. However, according to the 2022 Osteoporosis International Study, vitamin D, balance exercises, and proper nutrition reduce the risk of fractures by more than 20%. So the number of screens may scare you and lead you to medication. But lifestyle changes can save you, and it's in your hands. How reasonable do you think it is to have routine DEXA bone scans after the age of 70? Share your thoughts with us in the comments. Now there is another scan that can take you to a more frightening place. Yes, brain surgery. Let's move on to the fourth test you should not take. Test 4. Brain MRI for memory loss. There is one fact that we are all aware of. As we age, we start to become forgetful. It becomes difficult to remember names. We often lose our keys, and sometimes we even forget why we went to the kitchen. At this point, a natural fear sets in. Am I developing Alzheimer's? Or maybe dementia? And doctors usually request an MRI of the brain as a first step. Detailed imaging. Technological. It seems to provide answers. But behind the scenes, there is a completely different reality, because most brain MRIs of people over the age of 70 are of no benefit to you. A large study published in Neurology Today in 2021 examined the MRIs of 3,000 patients aged 70 to 85. An abnormality was found in 86% of cases. However, only 3% of these cases required treatment. Are you surprised by these results? So what about the remaining 97%? They were simply age-related changes. In fact, MRI scans of people over the age of 70 usually show age-related changes, which means slight shrinkage of the brain or white spots that are completely normal in older people. However, this condition was described as abnormal for people over the age of 70, leading to unnecessary procedures that carried risks after brain MRI scans. For example, patients with white spots seen on MRI were generally recommended the following: spinal tap, biopsy, unnecessary treatment protocols, brain surgery for some. Unfortunately, these procedures did not restore memory. On the contrary, most patients began to suffer from mental breakdowns. Moreover, some of them also suffered physical damage. Here, I would like to share the story of one of my elderly patients, Michael. Michael was a 75-year-old retired engineer. He was sharp, but he had noticed that he was becoming a little forgetful. He would search for his phone more often at home and sometimes forget names. And that's when a life-changing process began. His doctor referred him for an MRI. The result: white matter changes. Of course, Michael panicked. He thought he had dementia. He loved cars. Unfortunately, he stopped driving. He gave up everything that made him happy in his daily life, one by one. But when we re-evaluated him, his cognitive functions were normal in the tests he took. We explained to Michael that his MRI findings were age-appropriate. He just needed to increase his water consumption, sleep better, and do brain exercises. In other words, he needed to be a little more careful in his daily life. That's all. Michael trusted us, did everything we told him to do, and 3 months later, his memory improved. These small changes made a big difference in his life, and he returned to his old self. So what is the truth? If there are no seizures, sudden personality changes, or serious mental decline, an MRI should not be the first step. Instead of requesting an MRI scan for patients over 70, which is the first step your doctors ask you to take, ask for cognitive screening tests, which are a more accurate starting point. These tests are cheaper, effective, and prevent unnecessary panic. Are you forgetful? If so, what would be your first step? Share your thoughts so that you can guide others. Let's quickly move on to the third test you should not have done. Test 3. Cardiac stress test. It is normal to tire more quickly after the age of 70. You may become short of breath when climbing hills. You may not have your old strength. You may experience occasional chest tightness. Unfortunately, this test is often performed on elderly people with these types of complaints. Have you experienced these symptoms? What if the cause of your fatigue is not your heart? Unfortunately, many doctors recommend a cardiac stress test, to be sure. And the results of this test often lead you into a deeper tunnel. Yes, a tunnel of unnecessary tests and risky interventions. You want to protect your heart health, right? Then answer this question: should you really have a heart test after the age of 70? It sounds beneficial. A cardiac stress test is performed on a treadmill or by administering drugs that strain the blood vessels to see how the heart responds. But here's the bad news. This test is not as reliable in people over 70 as you might think. According to scientific research, the false positive rate of stress tests in this age group can be as high as 40%. In other words, the test tells you that your blood vessels are blocked, when in fact there is nothing wrong. The result? Unnecessary angiograms followed by stenting or even bypass surgery. So what does a cardiac stress test achieve? Unfortunately, most of the time, nothing. But what does it lose? A lot. Kidney damage, bleeding, prolonged hospital stays, and despite all this, No significant difference in life expectancy or heart health. A comprehensive study published in JAMA Cardiology in 2017 examined hundreds of patients. It found that more than half of the stents implanted after this test were actually performed on patients with no obvious heart symptoms, and that these interventions did not improve either quality of life or survival. The truth is, if you are over 70 and have no obvious heart problems, this test may put your health at risk rather than protect it. And that's exactly what happened to 78-year-old retired teacher Albert. He went for a walk every morning and spent the afternoons working in his garden. He had only noticed that he sometimes got tired on slight inclines. He mentioned this to his doctor during a routine checkup. His doctor took a cautious approach and requested a cardiac stress test. The test results were inconclusive. When it was suggested that he might have a blocked artery, an angiogram was immediately scheduled. A catheter was inserted into his heart. A slight narrowing was observed, and a stent was inserted. However, that night Albert had a reaction to the contrast dye. His kidneys failed. He remained in the hospital for 6 days. But the story doesn't end there. Even after he was discharged from the hospital, his fatigue persisted. His energy levels did not improve. The truth was that Albert did not have a serious heart problem. All he needed was to drink more water, rest between meals, and perhaps live at a slightly more relaxed pace. Remember, simple solutions are sometimes the most effective treatments. If you are over 70 years old and do not experience classic symptoms of heart disease such as chest pain, shortness of breath, or a noticeable drop in energy during light activity, a stress test may do you more harm than good. If you ask whether there is a safer alternative, the answer is yes. You can have a simple resting ECG done, or a low-radiation coronary calcium scan. These tests show your heart rhythm or calcium buildup in your heart and often prevent unnecessary procedures. Have you or someone you know undergone an unnecessary heart procedure? You can share your experience in the comments. Next up is a test that many people don't question the necessity of, but which actually carries more risks than you might think. You may be surprised, but our second test is a colonoscopy. Yes, it is a procedure that makes most people shudder just hearing its name, involving the examination of the large intestine with a long camera. However, after the age of 70, this test may not always be safe or necessary. Especially after the age of 75, it is not recommended by most experts, with some exceptions. Why? Because as you get older, the risks of colonoscopy increase significantly. First of all, the preparation phase is exhausting, like running a marathon. Strong laxatives can cause serious dehydration in older bodies, leading to dizziness and even kidney dysfunction due to being unable to leave the bathroom all day. Sedation, which involves putting the patient to sleep during the procedure, has been linked to complications such as mental fog that can last for days, memory problems, and heart rhythm disturbances in individuals over 70. And there's more. On top of all this, the risks of intestinal bleeding, ruptures, and even heart problems due to sedation increase during the test. According to a large-scale study published in JAMA Internal Medicine in 2019, out of 1,000 people over the age of 75 who underwent colonoscopy, only 2 lives were saved, while more than 20 people experienced serious complications. This translates to a risk-benefit ratio of 10-1. This ratio is strikingly clear. The U.S. Preventive Services Task Force recommends discontinuing routine colonoscopy after age 75 for most individuals. Instead of a colonoscopy test, there are safer options that can be performed in the comfort of your own home without a single drop of blood. These include FIT test, home stool test, and fecal occult blood tests, non-invasive methods for assessing colon cancer risk. These tests require no preparation, involve no sedation, carry no serious risks, and offer high accuracy. If you are going to have these tests, please watch this video again before talking to your doctor and make the right decision together. So, which test makes more sense for you? A colonoscopy or a simple stool test? Now let's move on to our final test. This test is presented to almost everyone as a kind of technological savior. But appearances can be deceiving. This test is a full-body CT scan. It is generally offered under the name of high-level health screening at private clinics or in special health packages for executives. Sometimes it is marketed as a way to detect cancer early, but there is a shocking truth you should know. This test is most dangerous for older adults, and there is no evidence that this screening saves lives in people without symptoms. Especially in adults over the age of 70, the risk of unnecessary follow-ups, biopsies, and even surgeries is incredibly high. In addition, each CT scan exposes your body to 10 to 20 millisieverts of radiation. This is equivalent to approximately 500 chest X-rays. In other words, one test is like 500 small lead bullets. And the worst part is that this dose accumulates a little more with each test. Unfortunately, we are opening the door to this risk of our own accord. According to a study published in JAMA Internal Medicine in 2023, the increase in CT scans accounts for 5% of all cancers seen in the US today. This is the cause of 1 in 20 cancers, which puts them on par with alcohol as a cancer-causing factor. In other words, when we ask, is there a disease? We may be creating the disease itself. Unfortunately, the truth is darker than you think. So what kind of results do CT scans produce? In elderly people over the age of 70, harmless nodules, age-related cysts, calcifications, and traces that have no significance in different tissues. But when the doctor sees these results, he says, just in case, and puts you through a series of tests. More scans, PET scans, biopsies. Then suddenly, you find yourself in a hospital corridor, filled with fear. I want to tell you a true story. When you hear this story, you may reconsider some of the most important health decisions you have ever made. Mark was 81 years old, and still an energetic man who taught martial arts to young people. He felt great. One day, he participated in an elite health screening for seniors at a special clinic recommended by a friend. Actually, he had never thought of such a plan. This scan was marketed under the name of an early diagnosis campaign. He had the CT scan done out of concern that he might have an unknown disease in his body. Mark's full-body CT scan revealed a tiny 3 mm nodule, which unfortunately set off a chain reaction. He was immediately referred to oncology. A PET scan was performed, followed by a needle biopsy. The result came out as good-natured, but during the biopsy, part of his lung collapsed. As a result, he had to stay in the hospital for 4 days and had difficulty breathing for 2 months. The wheezing sounds he made when breathing reminded him of the hospital. Do you think Mark did the right thing? The American College of Radiology is very clear about CT scans. Experts now say that full-body CT scans should never be performed for general screening purposes in asymptomatic adults. There is no proven benefit, and there may be serious harm. They say that if there are symptoms such as unexplained weight loss, only then can a CT scan be performed. If you wake up one morning coughing up blood or notice a rapidly growing lump on your neck, it is appropriate to have a targeted imaging test. However, randomly scanning the entire body just to check when there are no symptoms is like entering a minefield with a detector to search for jewels. Because this search can lead you to danger rather than treasure. The risk is quite high. If you are someone who says, I want to insure myself against the future, it would be healthier to stay away from these types of risky scans. Because most of the time, the results of these tests are inconclusive. A suspicious finding leads to further tests. And suddenly, even though you have no complaints, you find yourself in a medical maze with no way out, undergoing unnecessary biopsies or treatment plans that carry the risk of side effects. If I may suggest a smarter approach, listen to your body's signals. If you feel good, walk, smile, get enough sleep, and your weight is stable, then perhaps the best approach is not to get more tests every year, but to get more informed tests. Let your feelings guide your life, not numbers. Also, see your doctor regularly and don't neglect your basic checkups. This is vitally important after the age of 70. When was the last time you saw your doctor? Remember, modern medicine is powerful, but it is not perfect. Medicine can work miracles, yes, but sometimes taking a step back is the biggest step you can take toward health. For every test you take after the age of 70, ask yourself a question. For example, if the results of this test show something, am I ready to make a decision that will change my life? If the answer is unclear, if the risk outweighs the benefit, if the outcome will scare you even more, then maybe it's time to take a step back. But most importantly, real prevention comes before early diagnosis. Exercise, eat well, get quality sleep, keep your mind as lively as if you were in the prime of youth, and choose tests with your doctor based on your personal risks. These 5 golden steps that you can take every day should become part of your life. And remember this, the 3 most valuable treasures in your life are time, energy, and health. They should be managed according to your real needs, not according to fear, advertising, or other people's panic tests. So to whom are you giving control of your life? After watching this video, I want you to ask yourself, have you, your mother, father, or spouse been harmed by these tests? Has someone you love ever been subjected to an unnecessary test or incorrect treatment? What happened? How did you feel? Write your comments. Share your experiences. Because your story can reach thousands of people. And finally, which health tests should be avoided after the age of 70? Why are unnecessary screenings dangerous in the elderly? Should colonoscopy be performed after the age of 75? Up to what age should lung CT, thyroid screening, and DXA testing be performed? For these and more questions you may have, leave your questions in the comments. I can answer your question in the next video. If you found this information valuable, don't forget to like the video, subscribe to our channel, and share this information with an elderly friend or loved one. Because sharing knowledge saves lives. Because living peacefully and healthily begins with knowledge. Remember, age advances on the calendar. You are the captain of your health.